In Module 4, we'll talk about how to prepare the patient for the screening. Then we'll review how to prepare to review the results of the screenings for alcohol and drug misuse with the patient. Let's start by talking about preparing the patient for the screening process. Developing a relationship of trust and respect is extremely important. Using a calm, friendly tone and making eye contact during the conversation may help to build a relationship with the patient. Many patients may already be a bit anxious about their visit. Explaining that the questions are part of an overall routine screening process that the doctor uses to get to know the patient helps to calm fears that the patient is being singled out for these particular tests. If the test is being self-administered by the patient, encourage the patient to complete all the questions that are required. Once the screen has been completed, offer to answer any questions the patient may have or prompt the patient to complete any questions left unanswered. Adolescents should be encouraged to answer the screening questions outside of the presence of a parent. After the patient completes the screening tools, office staff can score the tool. Results should be reviewed by the clinician and then discussed with the patient for further review and confirmation. Alcohol and drug misuse can be difficult for patients to acknowledge, so clinicians need to be sensitive to the patient's readiness to deal with such issues. As a medical provider, you play an important role in your patients' lives. Your role becomes even more important when you consider that your intervention may have a very positive impact in slowing or stopping the progression of their illness. The screen can be scored by any staff in the primary care practice. Typically, it is the practitioner in the office who presents the findings from the screen to the patient. As the practitioner begins to talk to the patient about the screening results, it is extremely important to avoid a tone that is confrontational or judgmental, explaining that your role is to make health recommendations. Express your concern about how continued use may negatively impact health. Explain that there are different types of treatment available. If there are signs that alcohol or drug use has impacted the patient's health, it is helpful to explain that the relationship between substance use and the condition. The practitioner may also choose to ask questions that help in determining what next steps are necessary. The practitioner may wish to assess whether there is a potential risk of withdrawal symptoms, which may mean that a referral to a substance use provider for further assessment is necessary. If the patient is misusing opioid medications or drugs, such as heroin, the practitioner may choose to educate the patient about the potential for overdose. The practitioner may choose to consider a prescription for naloxone or explain that there are pharmacies in Connecticut that can dispense this medication, which helps to counteract an overdose. Primary care practices can be instrumental in helping to prevent the dramatic increase in overdose deaths through this brief education. We'll talk more about when to make a referral and treatments available for alcohol or drug use disorders in Module 5.